வருஷம்
அதான் அப்படியே ஆன் பண்ணி போறேன்.
சார் நான் கேட்கறேன், தப்பா நினைக்காதீங்க. நீங்க இந்த வேலை தான் பாக்குறீங்க. இந்த கால் என்ன வருஷம் வந்துட்டுமா இல்ல புரிஞ்சிக்குமா? ஒரு வருஷம் கொடுத்தா அது அப்படியே இதுக்கு போட வேண்டியது தானே.
நான் என்ன சொல்றேன், இந்த டாக்குமெண்ட் எல்லாம் ஒரு இடத்துல கன்சாலிடேட் ஆகும். சரிங்களா? நம்ம பண்றோமா?
ஏன் இப்ப நாம அவர் தானே வருஷம் கேட்கறாரு, அவர் தானே வச்சு
Sir, we can start, sir.
Yes, sir. Share the screen.
Ceremony, sir.
Sir. Just a second, sir. I'm just sharing the screen. Am I audible? Hello? Hello? Hello?
Yes, sir. You are audible, sir.
Yeah. Okay, fine. So, good morning to everyone, professors, students. Hello. Yes, sir. அப்படியா ஸ்டார்ட் பண்ண சொல்லுங்க. ஸ்டார்ட் பண்ணிட்டேன். ஓகே ஓகே ஓகே.
Very good morning. This is Mohan Raj, Assistant Professor, Karthayanaga College of Engineering Technology. I welcome you all for this expert lecture on 3D printing. Then I welcome our chief guest, Mr. V. Raimudi, Head Healthcare Technology, Andheri, Mumbai. I welcome you, sir. He is a mechanical engineering by profession and he has completed his master degree, MS by research in the field of additive manufacturing for medical application. He has over a decade of experience in medical image processing, Bio-CAD modeling, and additive manufacturing. He also being associated with market leaders like 3D System, Materialize, etc. Then he published his paper in Design and Fabrication of Customized sac fold for tumor bone using 3D printing in Additive Material Research in 2013. Then he published his conference in 2012 in the paper of Development of Design Pattern for Customized Bone Sac Fold in International Conference on Additive Manufacturing, Bangalore. Then he published another paper in 2014. The paper title is Design and Fabrication of Customized Sac Fold for Tumor Bone using 3D printing in first International Material, Industrial and Manufacturing Engineering Conference, Malaysia. Then he published another paper in Bioadditive Manufacturing of Customized Tissue Engineering sac fold for orthopedic application in Indo-Australian Conference on Biomaterial, Tissue Engineering, Drug Delivery System and Regenerative Medicine, Chennai. Then his achievement in design and printed of 3D printing orthodontic planes in India using for orthodontic surgery, particularly for facial corrective surgery. Then he designed various pattern-specific implements in PSI for oral and maxillofacial reconstructive surgery over 150 cases. Then he designed and developed several customized products in healthcare sector. Then he designed and developed multiple customized splints and guide for orthodontic surgery, dental implements and guide and orthodontic guide. Then he designed and printed the first 3D printed customized jig in India for placement of periodic screw in spine surgery. I welcome you, sir, for this expert lecture.
Thank you, sir. Just please confirm whether my screen is visible. Is it visible, sir?
Yes, sir, it's visible.
Yes, okay, thank you. Okay, very good morning to everyone. And thank you so much for Professor Mohan Raj and the team and the Professor HODs for inviting me for a wonderful opportunity to share a little of my experience. And yes, I'm heading healthcare in Sri Rapid Technologies. My company is Mumbai based, but currently I sit in Chennai. And before starting the section, I would like to give a small intro about what we are, who we are, what are things that we are doing in this industry. And it's I want to introduce my MDs, Nitin Chaudhary and Shashidhar Kumar. Their part in 3D printing, specifically in India, is a big, and they are the one who introduced the technology in India very first, almost 27 years before. And they have been constantly participating in incorporating this additive manufacturing in various industries. And the goal is not that's the reason we are always giving the end-to-end solution for the different industries for incorporating the AM technologies. And would say like sir, இப்போ audible இருக்கா? Hello?
Yes, sir. Yes, sir, it's audible.
Okay. Okay. So we have a setup in Mumbai in our head office, like called a Customer Innovation Center. In that almost we have a 16 to 17 3D printers, like starting from the basic DLP technology, SLA, SLS, and also the metal printer we have. So the reason we set up this technology, of course, it's to promote the technique and helping researchers to do their innovation to accessible materials and technologies that they want. And the ultimate goal is for the demonstration of each techniques. Yes, we have a pan-India presence, brands we represent. So coming to the today topic, of course, bioprinting. Before starting about bioprinting, I would like to give a small idea about maybe that's how started 3D printing in the healthcare. The thing is, first it's a technology that has been developed for multiple application for a long time, and the reason that healthcare, you can say for last 10 years, the growth of healthcare in 3D printing is like drastic. The reason is the requirement of the technology. Whenever we talk about new techniques, new materials, for whenever we are using for the different application, for example, automobile, aerospace, they are using for a long time. I think most people will aware about, we started with prototyping. We started doing prototyping, then the prototyping model became a working models, and then we started implementing the real model into the real manufacturing the models in the like pistons and whatever it is. And when coming into the healthcare, when we talk about the surgical procedures, plannings, and everything, that most required thing is not the external sheet. The detail, they want to understand, specifically the physicians, whenever they are going to operate some complicated surgery, some they always have a surprises. Okay, it's a kind of, we used to say every theater is a conference room. So once they, say like simple word, so open their body, so for the operation, then they will discuss what is a complication, what is the surprises they have when they operate it, and they have to manage it. It takes time, discussion, procedure, and all. Obviously the surgical time, the success rates, it's always a challenge in the surgical procedure. But this technology gives them the a better diagnostic tool, first of all. So when we talk about a better diagnostic tool, of course, we are aware about the CT, CBCT, MRIs. We always to see the 2D pictures of the CT scans, how the bone is defected. The radiologist will give a diagnostic report. So and so is a problem that we want to do. But end of the day, they will not get the 3D perspective of the, for example, if there is a fracture, they don't know what is the angle, what is the complication that they are going to handle when they are repositioning, whether it is easy to reposition, whether there is some other difficulties for them to reposition, whether they want to trim a bone. They don't have an idea. Everything is surprise for them. To this technology, first of all, give them the in-depth diagnostic tool, and they can do the mock surgery, they can do the surgical plate, customized implant, and now we can also use 3D printing as a bioprinting, and maybe we call it as a future as a organ printing. I think this picture I always love to show. This is exactly the operation theater 100 years before. Mostly your doctors will well aware about it. You can see in a generalized picture, all the PG students are watching the surgery from the floor above, and there is no air conditioning. They are using without mask, without gloves. There is no sterilization process, just they are putting into the hot water. And nowadays we more aware about the surgical theaters. The difference between the 100 years is the technology. Okay, and I always love to say it's a interdisciplinary. It's not specifically to the surgical part, whether it is a science or engineering. It's always interdisciplinary. We need a physician, we need a researchers, we need engineers to build together as a advanced surgical tools and planning procedures. So that's how it's a difference between the 100 years. And would say, like, whenever I talk about 3D printing in healthcare, there are three different workflows. We'll say like reconstructive surgery. Probably you can see it here. This is a reconstructive surgical workflow, and this is a orthotic and prosthetic, and this is a dental. So before starting about the reconstructive surgery, because that's how that goes into the bioprinting. But it's a long journey, as I mentioned. It's a 3D printing started from the basic tool, and now it's becoming a kind of tissue engineering procedures. They can imitate the mimic the organ natures, and probably it's going towards the future of the organ printing as well. And as I said, yes, okay, maybe this topic is on bioprinting, but I want to touch each and every topic. Then only we will understand the reason for bioprinting and what's, and main thing is what is happening in current situation, what is going on, how each countries are using this technology, and how it is benefit. And we started from the models. Most doctors, maybe you can hear them, a stereolithography model is the first technology that has been invented by Chuck Hull, or 3D system MD. And then slowly we started doing the surgical guides, patient specific surgical guides, for them to help to do the mock surgical planning for the model, and they can do the real surgical by using the surgical guide. So they can help us easily guide them to reorient the fractures or any cutting, we call it as a resections and all. And now, and specifically after COVID, patient specific implant, probably will talk about later. But the thing is, patient specific implant becoming a normal. Okay, and a lot of hospitals are started incorporating these techniques, and specifically mucor cases, like we call it as a black fungus. Okay, you will not believe that 25,000 cases are waiting to operate in India. It's a very basic numbers, I would say. Like 25,000 cases they have operated and removed the upper bone completely, and they are waiting for the 3 months observation to put the patient specific implant. And the next is bioprinting. That is what our main topic today. And of course, the future is organ printing. And there is a huge difference between the bioprinting and organ printing. Probably some people are interpreting like, bioprinting is we can print an organ, we can print a direct kidneys, lungs, heart. No, that's a organ printing. That may be in a research level, but bioprinting is something different. So probably I will explain in detail. And so when we talk about this, maybe the 3D printing, bioprinting, organ printing, whatever it is, the complete procedure in medical additive manufacturing, if we talk about the workflow, software takes a major role, because we are not developing a standard product. We are not creating standard plates or screws. I think the difference between standard, of course, they have some different sizes. They have to incorporate, they have to feed into the human body. For that, they have to trim some bone, they have to bypass some procedures and all. End of the day, it's not going to be exact match to the existing patient bone, since it's a standard, and there should be a lot of possibilities for the failure. That's the reason 3D printing has evolved in the higher way, because of it works in a customized procedure. Of course, nowadays we are looking at even a visa, everything we are looking as a customized process. But healthcare is a one is more needed. That's what is 3D printing is. It's going into that way. Every implant, every surgical guides is customized. For example, if somebody have a fracture of any jaw or something, we will take a patient CT scan data, and the scan data has to be taken in some format that is called DICOM format. You can see it here. That DICOM data has been imported into the medical image processing software. This software will compile the multiple slices. For example, would say like, yes, everybody has seen the CT scan. So you can see the black and white sheet. That's not a whole data. It's a sectional view of the particular region. Okay, the radiologist will take the specific defective portion and they will give you as a sectional view. But this software will take the complete data. For example, if you are taking a whole head as a CT scan, and the CT scan accuracy is a 1 mm. For example, my head is of the 300 mm of height. So you can find 300 slices in the data. Okay, that 300 slices has been imported into the medical image processing software. Specifically, the software will compile multiple 2D slices and will help you to convert as a 3D file. Okay, once you convert the 3D file, if you are going to print only the models, that is 3D printer models, you can export as a STL file and you can choose the printer, you can print and you can use it for the required thing, maybe the model planning or whatever it is. And if the specific patient need to be planned, designed, maybe it's a implant, maybe it's a surgical guide, maybe it's a scaffold, maybe it's some kind of organ they want to duplicate in the bioprinting, maybe in future they want to print it in the organ printing. That's what the designing part of that. Maybe we can simply say like a Bio-CAD modeling. And there are a lot of software. Yes, we are representing 3D system, the world leaders in healthcare and all industries. And that's what we are synthesizing, a two software that we are working currently. And printer it's completely your choice nowadays. A lot of plastic printers, polymer based printers for models. There are metal printers to print implants, and now there are also some ceramic printers. You can print almost as a natural material like bone, like hydroxyapatite, tricalcium phosphate, zirconium material. It's a ceramic base. Implants you can print, and maybe if it is a bioprinting, you can print a bio ink. You can print a scaffolds or small arteries, nerves, vessels, or something, and it's organ. Printing is almost the last part, and before that, software takes a major. The reason I'm talking about the more about software is this is a main thing. So because what you are converting is more important, what you are designing is more important. Then printer is, you are just going to choose the material, feed the material, it's going to give you your output. And specifically the more customization, treatment plan, designing, it happen in the design process. And when we talk about the designing, of course conversion is the main tool, because we don't have any reference. For example, if I'm scanning a automobile part, so I have a physical part in my hand, so I can cross check the quality of the scanning, whether it is correct, if there is any tolerance or there, I can cross check always. But if I am taking a patient data, so I can't cross check the bone inside it. Okay, but I don't know whether the software is converting the actual size or something scaled down, scaled up, some because it works on density. Okay, in bone itself we have different layers. Okay, so I'm not sure about the output quality. So how can I finalize it? But end of the day, I'm not going to do any trial and error. I'm going to use for the surgery. Sometimes I'm going to put something into the patient body. So I have to be very keen on what I'm doing. In that aspect, of course, this procedure has to be certified. Okay, that's the reason the conversion software need to be certified. Yes, FDA, this lot of certification is there. Yes, this software is certified and has to be very clear. As engineers, the reason I'm mentioning this and all, there are a lot of 3D printing companies, a lot of startups are there, a lot of openings for the engineers are there. So it's good. You can also focus on this field. You can learn biomedical applications. It doesn't fit only for the biomedical engineers. Of course, we are going to develop some devices, implants, so a lot of mechanical involved. So you can little bit understand about the anatomy. You can start working in this field also. And there are a lot of research scope in this application. And that's how it will work when we convert, like, you can convert the bone, you can convert the soft tissue, like, internal skins and all, whatever you want. You can convert the nerves, tooth, everything you want, you can convert directly by using the software. And would say, like, whenever we are talking about the medical image processing, as I said, CT or any data, you have to import it. You can see the anatomy like this. Okay, so once you import the CT data, you can see it. It almost like, it's not very complicated, as well as it's not a more CAD based as well as. So handling the software, designing some kind of customized bodies, implants, it's not a complicated process. So the complicated thing in this industry is application. So you have to understand how we can design an implant, what is the shape of the implant, how it will be, successful when we are putting into the human body. And we have to understand the surgical procedure, specifically the limitations. Yes, of course, the physicians have a lot of limitations when they are, because we have a software, we have all axis of angle, you can rotate, you can do like you can see in the video, we can do whatever we want. But the thing is, when it coming to the real surgery, they have a lot of limitations. We have to think in that way. That's how whatever you are developing, that's how it will get success. So understanding the application, the need, the complications, and the limitations is more important than the designing. So as engineers, designing is we practice with CAD softwares, we practice with CATIA, complicated softwares. Comparing to that, it's very simple, but application is a little complicated. Understanding the anatomical nature is more little complicated to understand. And this is how it will work. Once you convert a 3D model, you can just take it as a STL file, and you can print as a model. Okay, and then the models can be used for for doctors to physically they can touch and they can see the abnormality size. For example, this is one of the case probably we call it as a amyloblastoma. So kind of it's a kind of cancer. Okay, and this kind of cases it's a removable cancer. They have to remove properly. For example, you can see it in a transparent mode. There are some internally lesion has been extended. If they missed out to remove the proper thing, if little bit of the lesion is existing into the bone, then it will reoccur. So they have to be very clear, and sometimes to avoid the reoccur, they will remove more bones. So in this technology, by using the software, they can see exactly what is the internal lesion, extension, they can do the measure, and they can prepare the cutting guide based on that. And this is how it will work. Some outputs, probably the blood vessels of the around the brains, complete skull process, and you can see the internal organs, cancer cases, so lungs, ribs, bones, orthopedics. So you can take the existing metal implants. If that fails, you can exactly diagnose that also. And of course, designing the second part, as I mentioned, only model you can go for the model, and if it is a designing is required, probably we have to understand the specific case history and what their exact requirement, what is the limitations. Based on that, you have to design it. And main thing is, this software is not a specifically CAD based; it's a sculpting based software. The reason initially this software has been using for sculpting more on jewelries, little bit, toy industries more, and other industries, not healthcare. So we saw this tool, that haptic device, in 2014, and in my first company. So we got very surprised, and we immediately want to try with healthcare. And we work with 3D system. 3D system has supported a lot of the time because we are just a startup. So they believe us. They provide all the required software versions, devices, and all. And we started working with the basic model preparation, and then we started doing the surgical planning, and then slow by slow we started doing implants. Like this is like more flexible as well as accurate, and also since the thing is we are not working with the parametrical structures. It's more on organ shape, so you can't design something with the primitive shape structures. You have to do always based on the existing fractures and all. Sometimes we take a mirror body. Sometimes we don't even have a reference. We have to consider the soft tissue in this development. And mainly the haptic device will give you the touch feedback. For example, if you're cutting a cake, you will feel the consistency. So like that, the device, instead of mouse, you have to use the device. It will give you the touch consistency in the 3D. And like, if you're having a skull in your hand, you are putting some clay to match the fractures and or something, the same feel you get the device. Okay, you can touch the bone, you can cut the bone. When you are cutting the bone, you will feel the density of the bone. And almost in other ways, a lot of doctors are using this device for doing their mark surgery. So of course, as I said, it's gross. Model is going to be stopped one day, so they are going to do all digital. They need the touch feedback that will be transferred to the haptic device. So that's how it will working. And this is how they will do, like the thing is simply we have to just reciprocate the surgical procedure into the digital flat. So these are the exact surgical cut. In term, maybe we can say like this is a kind of orthognathic surgery. And yes, I am doing this surgical planning started from 2015. Almost I have experience of 300 cases to assist. Like we do this all surgical cut, we do virtually planning for the things that doctors want to achieve in the theater, as we call it as a post-operative plan and all. We do all the planning, and finally we fix this is what the required final would say like a bite, would say proper occlusion, like proper tooth positioning and everything. And then we create a small sprint and cutting guides for this, so they don't want to struggle. For example, it reduces the 40 to 50% of the surgical time and 100% avoids the failures. So the cases are 100% success in that way. And like, jaw reconstructive surgery, they will take a bone from our leg, how they can position it, proper profile. The main thing is you can see the more of the standard plays will not give a profile, face profile. So if you don't have a face profile, it doesn't look like you, somebody else. And the main thing is profile, function, no possibility of functionality in normal traditional procedure. Even if they have a put up bone, they will put in a straight bone. There is no professional look, proper aesthetic look, and as well as they can't get the functionality. Most of the time get fails because of the screws, plates. Sometimes they put it in a wrong way because they can't understand. They can see the bone outside, but they cannot see the bone inside, whether it is porous, whether it is strong bone. Sometimes if it is a porous bone, the screws will get failed. That's how it goes in a wrong way. So in this technology, we will get all informations. And maybe the spine surgery also, pedicle screw placement. Scoliosis is most operative surgery in India. Of course, maybe a few people are aware about it. And surgical planning, as I said, reconstructive surgery, you take a mirror, you can design whatever it is. Orthopedic, implants, lattice structures, probably more people will talk about lattice structure nowadays to lightweightening. And some, if you say the biological property, we also call it as a scaffolds. It will give a, of course, it reduces the weight of the implant, as well as it give you a better osseointegration, like bone will regenerate quickly in that aspect. Scaffolds, it's more related to our bioprinting. This is how it work. And also I would say like, yes, my master's is on scaffolds for orthopedic and other bone related applications. And almost we can, I will also show my studies in the latest slides. And almost it's almost the just previous step into the bioprinting. And implant design, probably you know that. So how to design an implant and all things. This is a software, I would say, like just to show, since as engineers, you can see this is a software. You feel very happy. This won't have any regular CAD tools. So it's almost like, sculpting this. You can see whenever you see this video, most of the engineers will say, sir, it's look like painting. It looks like, Adobe Photoshop or something like this. Yes, it may looks like that, but the thing is, as I mentioned, application understanding. Sorry, somebody has put in. Yes, okay, thank you. And this you have to understand the shape, structure of the implant. Based on that, you can design it. As I said, designing is not a complicated. How we are going to design shape, structure is a complicated part. Okay. And this is how it will work. So I don't want to run a full video, just to cut on. And there are a lot of printers, like you might aware plastic, polymer, lot of different materials are there. When we talk about the materials, would say like plastics, polymers, they are used for medical models, surgical guides, and metal. Titanium is a golden standard. Currently, we are using for implants, and ceramics. So, sure, we will see everything. As I said again, so we will show each and every procedure, like every step of model, surgical guides, and implants. And I will also love to show some real case studies. Maybe all my cases, maybe the report you will get more understanding. So this is okay. This is from 3D system. I feel like I have a lot of model cases, but this may be more impactful case study. When we talk about models, this is how 3D printing has started. Okay, in the initial level, they started printing anatomical model, patient-specific model. That is what they will take a CT, convert it, and they will print the model. And this has been done in 15, I guess, by 3D system. So congenial twins, they have to separate their thing, and mainly they, you can see it here, the organ, one of the kidney wall has been involved into the opposite body, and they can't able to find which way they can separate it, whether it is cut the existing nerve, whether it is becoming complicated. Sometimes kidney is the most important part that they have to consider. So separating the kidney nerves and all things is a very complicated surgery. They roughly allotted 20 hours, but they are able to finish it in 12 hours. And more thing, they avoided the complications. The surgery was very smooth, and they got a complete visualization where they are going to put a CAD. And main thing is, before printing the model, they have sit into the 2 to 3 hours of the virtual planning. So they, as per their physician's instruction, the engineers, biomedical people has done all the every cut. They separated. They sit in a complete virtual planning. Then they print a model. And this I feel to be a very good example how model change. Even a model can change the procedure, like from 20 hours to 12 hours, and more than that, there is no complication, more time for the critical timing of the surgery. And other models like different applications like maxillofacial, spine, orthopedic, whatever you want, the models, always the information is enormous information. The surgeons will get a physical feel, and they can do the mock surgeries, and they don't want to stuck anywhere in the surprises. So like they know what is the output. Okay, they know what is it's going to happen after 2 hours of surgery, so they're pretty sure about what they're going to do it. So there is no trial and error works on that. And we talk about the surgical guide. Of course, models can help, and if they want to do the perfect cut, perfect resections, of course I have 2 cases. Maybe it give you more show you the benefit of the surgical guides. So virtual planning, and then you have to prepare the guide. Based on the guide, they have to do the surgeries. And maybe I would like to start from the syndrome case. This has been done in Savita, Chennai College, Upton syndrome. It's I think it's a 1-year-old baby. It's operated 3.5 years before. So you can see the abnormal skull, and main thing, the complication of this surgery. Usually they will not do. They will take it later of 2 to 3 years, and sometimes it's a lot of complication of the cutting and finding the particular suture points and all. Maybe, but simple. They have some reference points. That's how they have to do the resections. So we just do the virtual planning. So this is a perfect cut. Maybe it looks like some shape, but there are a lot of angular planning. There's some points are there. We have to do all the virtual plans. So this is the exact cut, and also we did a virtual planning. They have to move the cut portion of the forehead into the front side, and we got a setback in front and everything. They want to replace all the things. So we did all virtual planning that we can do like this, like that, along with the surgeon. We brainstorm one-on-one. They explain their requirement, and we just reciprocate it with the virtual plan. So the information is more important. So we are just transferring the information to the physical planning. So you can see this is a simple cutting guide. They can put it, they can take the reference on the outer side, and they will remove the resections. And this is a small block that will give them the guide, because we can't prepare a bigger guide, because the restriction is of putting a bigger part is more complicated. And that's the reason we just printed a small square box. So when they place it, they will have a stopper over there, so that they can find how much movement they can come for at one step. So this is a printed guide. So I don't have a surgical picture of this because of the pediatric patient. And maybe the same kind, spinal, maybe the failure case. It's a very good example. You can see the scoliosis patient as a complete, you'll not believe this is a spinal bone, okay, of adult. Okay, so you can see the fracture happened because of the, I won't say wrong placement. They have placed based on their information. Okay, we can't say absolutely 100%. We can't judge. We can't command on doctors. They have done wrong surgery. Okay, so even an expert, they can put some screws, plates, or anything based on their information. I would say that there is a lag of information for the surgeons. That's what 3D printing is changing. Okay, that's the reason. So they put it in some way in a different location, some way in a porous region. So it get loose, it might get fractured. So we just exactly remove the existing screws, plates, and you can see the spinal separator and the segmentation. So as per the doctor's requirement. So you can do the virtual planning. So it's called a pedicle screw placement. It has to be placed perfectly in between this region, It should not expose outside. It should not touch any of the nerve regions as well. So we did the virtual plan, and we will get how much deep we can go, what is the size of the diameter, all information. So based on that, we just want to create a small guide. So it's a concept of jigsaw fixture, and main thing is, it has to be fit over the surface. And I also always believe on designing will not, like, we can't put our mechanical shape structure into the organ body. So I always believe on developing some surfaces from the existing bone, then only it will match and it will fit exactly into the bone profiles. So the material that we use, as we talk about the materials, yes, there are different material, as I said, few material. Biocompatibility is it's a common word, but there are three different things out there. Maybe in future, maybe four different things. Biocompatible means, okay, it's compatible for the human. And in that compatibility, there are few materials, plastic materials, they are biocompatible to use inside the body. And there are few biocompatible materials like titanium, stainless steel, okay, and ceramics are biocompatible to place inside the body. And when we come into the bioprinting, there are some biocompatible materials that will mimic the human organs. Okay, maybe in future the biocompatible goes into the material that will replicate the human organs. So that's biocompatible is a common word. So anything that biocompatible is not allowed to place or not allowed to this. There are certain different things out there. This biocompatible material is allowed to use inside the body for a period of time. Okay, and there are a lot of protocols has to be before placing inside it. And this is a guide, this is a model. You can see the surgical picture. Once they open it, they will put the guide and they will create a surgical screw position exactly, and they will remove the guide and they will put the pedicle screws. You can see the already placed screw here and guide here. And this is how the post-operative surgery. You can see the main difference and exact planning of the pre and post. They can't able to achieve this kind of profile, not 100%, not all the cases, but a few cases is much complicated. In that case, it works like anything. Okay, I've been working with Dr. Karnaran sir for a long time, and the person who the reason for my the current career. So because my first experience in 2012 when I was a student, I did my master's in Anna University under Armikana ma'am, my professor and guide. And main thing, I got opportunity working with him for one case of 8 years worker, and that's create a big impact for me, and that's the reason I was to work in the same field, like surgical procedure and all. It's a big experience, and we keep on learning things on that. And okay, before bioprinting, maybe the metal is a current thing happening for the reconstructive surgery. Of course, titanium is the main material that we are using for 3D printing. There are cobalt chromium is there, they use it for dental. Stainless steel, we are not much preferring for it because it's not exactly the good solution for the implants. We'll show a few cases probably, maybe only one case I have, I think. Yes. So this is a young patient. So I have a ameloblastoma. It's the converted video. You can see it in D2P. And this is how we plan. We find the lesion position, what is the extension we needed, cutting guides, design the patient-specific implants. This is a printed guides. This is not an exact guide that we used it. This is a dummy. Exact guide is in a different material. And this is a printer, a 3D system. Printer has been developed to print patient-specific implant. And material, the printing technology is it's a very big deep dive. It takes almost 1 hour to explain the material process and everything. And this is a printed implant. You can see it here. So this is what we place the open the thing. We'll place it and we'll cut the resection, the lesion, and put it the customized implant. So this case has been operated in Trichy in 2018. And Dr. Muralidhar is an maxillofacial surgeon, and a very good case for us to do that. And also, as I said, ceramic is also one option. You can see the ceramic cranials, spinals, and a lot of applications are there. Okay, so into bioprinting. The reason I took this much time is because bioprinting is not a one single topic. 3D printing takes a major role. So I would maybe a few people may aware, but I want to say, like, bioprinting is not only part. So it's a long journey, as well as we have to understand the workflow, and the software part is common for everything. Even if you want to print a some organ parts, some shape, structure. You have to design, convert, and develop, and then you can put it. Only the printer will change. Based on the printer, the material will change. As I said, each and every technology have their own specific material to use, and bioprinter, it's totally different. And main thing I would say, like, it will create a human body outside the body, so organs and all. And okay, so what is bioprinting? Most even when I hear about the bioprinting, you can print organ and all. Yes, of course, it's a future. Uh, Research is going on, and of course, the company that we represent, they are into the timeline of 4 to 5 years to print the scaffolds. Not even an organ, it will take little time because it's not that much easy. The environment, the biomaterial they have to develop, it has to react properly. And currently, what is 3D bioprinting? Of course, you know, additive manufacturing is layer by layer technology. In each technique, we are using different materials, and probably we can take an exact example, the FDM machine. So FDM technology, fused deposition molding, is a plastic based thing. We have material in the coil. The coil has been put into the nozzle, so it will melt, it will create layer upon layer. The same thing, instead of the nozzle, instead of the coil, we have a material called bio ink. Okay, and instead of nozzle, we have a syringe. It's almost like our normal syringe. Okay, that syringe will, we have to pour the bio ink into the syringe, and we have to fit into the nozzle, and it will print the same way, layer upon layer. Sometime if you want to create a multiple body dissolvable, so we have to put some existing conductive solution into the plate. And the print platform is kind of we call it as a wall plate. There are different say like they have small kind of plates. You can see this is a kind of plate. This is a, so they will print over that. Okay, it's the biological tools that we can say. Okay. And the material that we are using, of course, as I said, it's a biocompatible material. You can also ink, also called the bio ink. Okay, it will behave as a natural organ. For example, if I have a material that will be the replicate of my lungs, okay, it won't work like lungs. We can't put it into the human body. Okay, for example, if we found, for example, for a COVID test, COVID, when we have faced a COVID, they have created a lot of medicines and everything. So they have to find how it works. When we have a vaccine or something, how it reacts, how it, any medicine, any drug, they have to find the reaction of the drug. But usually what we'll do is animal study. Well known about animal study, laboratory study. This bioprinting materials and sorry, somebody has put it below. Okay. Material will better than the animal study. It will mimic the human behavior of the specific organ based on the specific bio ink. So as a technique, of course, it's a layer by layer. Instead of other materials, we have a bio ink, and instead of different technique, we have a syringe. Ali, we have a syringe, and each other companies have a different things. That's not much better difference. Everything is a fused model, so it's a liquid injecting process only. Okay, and okay, why we need bioprinting? For example, it says you said there is no organ we can print it. Then why we need a bioprinting? As I mentioned before, it's more useful for us to test the new drugs. Okay, any medicine that you are developing, any medicine that researchers are developing, see, they don't want to go for the animal test every time. Okay, so they can do this bioprinting. So for example, something for the heart, something for the lungs, some medicine has been developed for the kidneys. You can print a kidney, okay, and that kidney material will mimic as an exact human kidney, so that when you are putting some new drugs, it will show the result. It will react. Okay, before it almost like testing into the human. So we can't test any medicine to the human. We always meant it to the animal testing. But of course, animal testing is not 100% will replicate the human reactions. Okay, so that's what bioprinting is little better than the animal testing. And would say, like, commonly the mentioned the study of body outside the body, and main advantage is, okay, The term 3D bioprinting, of course, we have a material, that biogel, even the biogel, whether it is have a physical shape or not a physical shape, it's going to react the same. But why need a 3D bioprinting? Because 3D bioprinters can give you the physical shape, physical shape for the specific bioink. For example, if I'm printing a kidney, if I'm printing a lungs, arteries, you can get a physical shape. So almost it's like, testing into the physical part of the body. And mainly it's used for the research development, and you will not you don't want to restrict with the animal testing and all, so you can do the repeated process, and mainly for drug testing. And in future they are developing some real organs, so for that it's an initial level. And I would say, like, it also helps in another way, that you can um, create or develop the human would cells. Okay, probably you might hear, so whenever we there's a new baby, so once they're born, the stem cell storage has become a big things. But we are not sure, but how many people are aware about it. It's not proven it. There should be some future. If there is a required, we are storing our stems. Okay, so the thing is that reality is stem cell is, of course, it can help you for some hereditary or some kind of chronic diseases in the future, but it's not right now. So they are hoping in the future, and they are started storing now. And I would say, okay, we can't comment much, but it's became a little business point, marketing point. And mainly this kind of thing has been now in active research process. They are trying out on that. And the main thing is the bioprinting is more important. The more biological researchers, physicians and engineers, biomedicians, they have started focusing more on bioprinting. Even 3D Systems acquired a bioprinting company recently, because it's going to be a series, it's going to be a future. Would say, like, one of the essential, let's say, okay, we always depends on US numbers and all. So that I searched for Indian numbers, but I didn't get some proper value. But what they are saying is over 120,000 people in US itself, they are waiting for the organ transplantation. Okay, currently it's not happening, currently it's not possible, but they are working on future to develop it, because there are a lot of chronic problems. They are keep on their internal organs are go on damaging day by days, and sometimes they are going for the transplants of organs, lungs transplantation, kidney transplantation. The transplantation is not 100% successful. Most of the people are getting some problems. Okay, and those things has been solved by using organ printing and bioprinting, tissues and all. And main thing is it's a combination of work, multidisciplinary, and they are hoping to develop organs. Some days it's going to be transplant, instead of taking a transplant from one body to another body. So they are working to 3D print real humans. That's what more important. And also to generate the cells. Okay, also you integrate the cells to have developed cells. They can put some cells into that. That's what the stem cell they are hoping it. So they are not going to shape or 3D print anything. They said we can give the stem cells so that it will create some new fresh cells in the body once we remove something. So that's how it will work. So that's what the bioprinting is more important than it will taking towards to the future of the healthcare procedures. And how does it work? So of course you can see the video. It works in a more simpler way. I would say, like, there are a lot of people are already started developing their own bioprinting, and would say, like, I heard and I have seen a lot of engineering students. They have started developing, and most of the project they said, sir, I'm building a FDM printer. So because one thing, you can get a spare parts and you can assemble, you get a printer, and someone you can also develop the process and everything. Since the technology is almost like FDM, so people are started developing. And main control and main important thing in this technology is material. In any technology is a material. That's the reason most of the OEM have their own material, and some people will take it as it's a business point. Okay, because they want to get a control of material and all. But okay, maybe that point, but I would say in healthcare, it's not something that we can do trial and error. We are going to put it to the human body. So we can't take the risk. That's the reason the companies, the principals, they have developed, they have research like 3D system. They have keep on doing a lot of researches, and they are keep on changing the parameters in metals, the accuracy, the output. Main thing, you can physically see the quality and the shape, size of the product, and the hidden quality is the chemistry of the material. So because it goes through some heat treatment, sintering, fusing, whatever some reaction will happen. Whether after the reaction, whether the material is sustaining the same, whether it is quality, whether there is any oxidation is happening, whether it is any mechanical properties is changing. We can't physically see each and every time. That's what it's always, work with the proper material, then only we get the proper output. So that's a material. Is a few companies like selling, they have materials, and we Alibi have their own materials of bio-inks of the different application, different would say like application, different ink for the different organs. And this is how you can see the head as a syringe. You can see the filler inside, and maybe it's like our normal syringe. When we fill the things, we have to just open pour the material, put in the syringe, and putting into the fusion head, and it will start feeding over there. You can see that this is what the plate that we put it. Once they take printed it, they will take from this. So you can see that this is supporting agent on this. This is a company that 3D Systems acquire, and we are representing right now. They are having a different model of machines. It's a single head, a dual and triple head machines, and they have a multiple materials for each and every applications. As I mentioned, material is more important, and the bio ink, we call it as a material. Okay, it's almost it's the same biocompatible materials, and maybe from the natural or synthesized biomaterials. And the exact thing is, it will mimic. I call it as an ECM, extracellular matrix. Okay, that will give you the natural reaction of our human body. For example, if it is a if we get some toxic smell or something, obviously we will react. We will do the cough, we will do snuffing, those reaction. Like for example, I'm saying it's not an exact example. If it is something child is just doing, the thing is we will react always. This material will react specific for the each organ. That's what the real thing. And main thing is it's a living cell. Okay, it will print the living cell. It's almost like a living organ, but again I say it's not a replaceable. We can't replace into the put it into the human body. It will it's a I would say like duplicate dummy of our each and every organ. So it will react, it will show the functionality. For example, whatever we are putting, we are feeding, it will react based on this material. That's how it will work. That is called bio ink. And there are a lot of bio inks for each and every application. As Alibi 3D printer, they have a variant kind of materials. You can see the combination of cells and conductive solutions, polymer, polymer liquids and all. And for this is a different materials. This is a material combination, and this is for different application like liver, heart, bone, cartilage, kidneys, and each and everything. So the main thing is it currently mostly using for the drugs testing, okay, and tissue generating, and for a lot of R&Ds towards going for the organ printing. So that's how it works in the bioprinting. And I would say I have covered everything. Yes, of course. The main ideology of bioprinting is that printing a physical model that will mimic, react like a human organ body. Okay, and the main reason they are using for the drug testing and also some R&Ds activities and all, it better than the animal testing, that in vivo analysis. And like when we are doing some testing into the 2D body, like we can compare it to the 2D printer and 3D models. Okay, so that's a difference. It will always give you the bigger profile, bigger reality on growing of the tissues and cells and reaction of the drugs what we are feeding onto that. Okay, that's how it will work. So this is what about bioprinting. I would like to show a small example, maybe the procedure how it works for the bioprinting. And okay, this is my thesis. Scaffolds takes a major role because in general terms, scaffold is a structure that will help you to give a better cell growth, we take it as a term like osseointegration. For example, if you are putting some customized implant or any bone supplements, a solid model, comparing to the solid model, if you are giving some structures, that is called scaffold structure, that is equally distributed structures, and that structure allow the bloods, protons and neutrons that has been go together, so it will help them to regenerate the bone into that. It will be almost allowing the body to be normal, so that a lot of cells has been grown over the implants, and it will create a better atmosphere to react like a nature, so the failures has been reduced. One point, and the osseointegration is more higher than the standard implants. End of the day, it reduces the failure, and it will lightweight as well, and it will have the same mechanical property. That's what the scaffold will do. And this is a small study of my study, taking a shape of the bone specifically and putting some unit cell. This is a long procedure, I would say, like it has been done 2012. And nowadays there are a lot of advanced softwares. You don't want to do all the workflows and all, so you can do very simpler way. And at the time we just did a biological testing, and we printed in a polymer. As I said, it's a biocompatible. Even this compatible material we can't place inside the body. I just used it for the laboratory test. So I did this is a printed scaffolds, and maybe these structures are called lattice structures, like orthogonic, tetragonic structures. And this is exactly the study. For example, this is what currently mostly we are doing it. So we are just creating a sample. Sometimes they are not creating a sample, they are putting in the conducting agent and feeding the cells over there. That's give a good atmosphere like a human body. They place it into the incubation, and that will started growing. Then they will find whether the cell is growing in this medium, in this atmosphere, or another thing. Based on that, they will use the cell in some kind of surgical or research activities. The same way, I just create a scaffold, and they will put it the same emission scheme and scales and all over there, and different plates, and we just did the MTTSA test. I don't want to go deep, but the thing is, the test gives a result of, if a scaffold is there, we will get a threefold improvement of the growth of the bone. Okay, the osseointegration will act like threefold. This is a sample one is a solid model, sample two is a scaffold model. You can see already 3 times faster. For example, a normal model will create a bone in 6 months or 8 months. It will create in 1 or 2 months, and it will create a more adapt on this, so the failures will be reduced. The same thing now in bioprinting, you can print a scaffold in a biomaterial, and you can feed the cells over there, and you can see the growth of the cells, because it's a kind of soluble. You can going to implant this scaffold when fully filled with the human cells into the human body. That's what's the initial stage of organ printing. That is what Alivi is doing a research on, creating scaffolds. They are planning to print a scaffold with a bioink. We can do it in either way, that is scaffold in the bioink. Currently, they are printing some scaffolds and feeding the cells and seeing how it grows and how it's reacting and all. So probably to help you to understand that. And okay, so maybe that's after bioprinting, it's organ printing. So this is a very funny picture, but it's going to be a real soon. I used to show this picture almost 6-7 years, and hoping it may happen soon, but no, it started already. They are developing their all blood vessels, materials, and each and everything. So maybe it's soon we are going to have a real organ printer who can print and place into the human body, and maybe that's good start to with the bioprinting right now. Yes, 3D printing has been into the different application. As a mechanical engineer, I have been aware about how it works in automobile and all. And when we see into the healthcare, of course, healthcare is not more different subject to tools, plates, devices, and everything. Now it's such a different field. It's more interesting. say like it's a R&D thing and developing. We have to do develop fracture. Every surgeries has been done in different. And please let me know if you have any questions on that. Hello.
Yes, sir.
Yes, sir.
Ah.
So, any questions?
Sir. Sir.
Hello. So, am I audible?
Yes, sir. Yes, I'm audible, sir.
Sir, it was a very nice section, sir. We learnt a lot. Thank you, sir.
Thank you, madam. Thank you.
Sir, is there any online courses, sir, to learn this 3D printing?
Okay. So I am not conducting anything. So there are a few people are doing. Probably I would say like I'm not sure about how potential it is, and it's better you can learn, from any of the institution, NIT, Anna University in manufacturing department. Professor, my guide is there. You can go and do some smart studies. There are research people so that they can help it, and you can contact me also. So I can guide you. I can tell you whoever you can contact and all.
Yes, sir.
But there is no proper courses is happening right now. So even I don't have that.
Okay, sir.
But I would say like not in the earlier stage like where we are doing PGs or UGs. You can learn most things in YouTube. Okay, so maybe the practical experience is not possible in YouTube, but you can get there are a lot of online videos even in YouTube. I would say like when you want to learn about bioprinting, just pick 4 to 5 companies, maybe 2 companies like maybe Alibi and also Cellink is another company, and you can go to their website, go to their YouTubes. Not like previous thing. Nowadays companies are technology based companies. They are equally like how they are promoting the product, they are equally teaching the product, so you can learn easily from them. So they are lot of videos, lot of webinars is happening, and maybe you can follow in LinkedIn also. So even I'm conducting a lot of webinars, not a courses, I'm doing a lot of webinars. You can also do that webinars.
Okay, sir. Thank you, sir.
Yeah, sure.
Participants, if you have any questions, please ask.
Yeah, actually, I have shared my mail IDs and also my contact number as well as LinkedIn. Probably, if you have any doubts in future, if you need any support, yes, please don't hesitate to reach me. And I think we can conclude. Sir?
Yes, sir.
Okay, sir. Thank you. Thank you so much.
Sir, thank you so much, sir. Sir, now it's a word of thanks. Sir, thank you very much for giving a wonderful speech and giving a wonderful lecture on the 3D printing organism, sir. It's very much useful for everyone, and we get the lot of knowledges regarding on the 3D bioprinting, sir. So thank you very much, sir.
Sure, pleasure.
Thank you so much, sir. Participants, all of them, just fill the feedback form. Just make a post in the chat box. After that, you fill, then submit it to the form.
Thank you, sir.
Participants, we have filled the feedback form, so you can leave the meeting.